Hi there, welcome to another installment of My Ultrasound Diaries. On this day, I scanned a 48-year-old man who presented with significantly reduced vision in the right eye, along with a sudden onset of floaters in the same eye. And these are my ultrasound findings. Upon sonographic evaluation of the right globe, a thick echogenic membranous structure was identified within the vitreous cavity. It was noted to have minimal mobility with eye movement during dynamic assessment. Importantly, the membrane remained visible with gain reduction, suggesting that it represents a true anatomical structure rather than an artifact or low-level echoes. The membrane demonstrated areas of folding and curling, giving it a wavy configuration within the vitreous chambers. On further evaluation, this membrane was seen to be attached posteriorly at the optic disc, where it appeared fixed and inseparable. Away from this point, the membrane was detached and floating within the vitreous cavity to peripherally attach to the lateral walls of the globe, represented by the ash symbol in these images. In addition, both globes demonstrated symmetrical diameters. The corneal echoes were normal, with no abnormality of the anterior chamber. The lenses were clear, without opacification, and in normal positions bilaterally. The optic nerve sheath diameters were within normal limits, and no intraorbital collection or mass was seen on both sides. The contralateral eye, that is the left, had no such membrane as seen on the right. The presence of a thick echogenic membrane with limited mobility within the vitreous, tethered to the optic nerve head, is characteristic of retinal detachment. It is an ophthalmic emergency requiring urgent specialist evaluation and management. And here is my report. The right globe demonstrates a thick echogenic membranous structure within the vitreous cavity. The membrane persists despite gain reduction. The membrane demonstrates minimal mobility with eye movement, with areas of folding and curling. It is seen to be attached at the optic nerve head or optic disc posteriorly and peripherally attached to the lateral walls of the globe. Contralateral eye appeared normal. Impression: ultrasound features in keeping with right retinal detachment. The differential is posterior vitreous detachment. This is less likely because it is usually thinner and not tethered to the discs. Stay tuned for more ultrasound.